Hello everyone. So today we are going to discuss about process recording. So process recording plays a major role in psychiatry, especially to have good communication with patient, that is nurse-patient relationship, and to collect data about the patient, to have good interaction with the patient, and to develop trustworthy relationship with the patient. This process recording will help us. And also this process recording is an important not only in nursing. So this is an important and necessary function of any organization. So whether it is an industry or it is an business enterprise or an hospital, it doesn't matter. So this process recording is a necessary function of every organization. And this recording, process recording done in different ways and different organizations and different situations, especially for nursing. So this process recording, it is a method of recording used in psychiatric wards by psychiatric nurses. So this is the introduction. Uh, this process recording or the written reports of verbal interactions with clients. They are verbatim accounts written by the nurse or students as a tool for improving interpretation communication techniques. So then we will see definition of process recording. So process recording is a written account recording of all that transpired during and immediately following the nurse-patient interaction. So, which means this is the recording of the conversation during the interaction of interview between the nurse and the patient. It's where in the psychiatric setup. So with a nurse's inference, okay. So it may be written during the interaction or immediately after one-to-one interaction. So especially this is interaction between nurse-patient relationship, conversation between nurse and patient. So then we will see about purpose. So, or the first purpose is to critically analyze communication and its effect on behavior of the individual. So, through this process recording, so we can come to know about the particular patient's behavior. So, we can come to know the behavior of the individual, and we can gain the patient's confidence and get this cooperation. So, through maintaining proper communication with the patient, to encouraging the patient, so we can increase patient confidence level. So, to increasing this confidence level, automatically what will happen? So, people will help us in cooperation. So, especially while collecting data from the patient, so cooperation is very essential. Why? Because so if there is a proper cooperation, so we can get proper data, proper answers from the patient. This will help us to know about the patient, as well as this will help us to identify the problems of the patient. So, and the next one is to establish rapport with the patient. So this is one purpose. And to study the patient's psychological, social, and emotional behavior. So while seeing the case sheet, so we can get little information about the patients. But when we talk, when we start conversation with the patient, what will happen, So we can come to know the patient emotional behavior and socially how they will react and the psychological aspects, how they will think. So what is there inside their mind. So those sort of things we can get it from the patients. So through this process communication. And this process recording helps to increase the ability to identify the problems and develop skills in solving them. So through this technique, what we can do is, so we can this will make us to identify the problems easily, and based on the problem, identify the problems, we can develop and we can plan some solutions to solve the problems, to solve the patient problems. So, and it gives students an opportunity to gain the ease and their function in written expression, so that are important for professional development. So this is a best platform for student. So while interacting with the patients, people will get many informations. They can learn. So this is especially for their professional development. This process recording help them, and so the this will assist. So when we apply this process recording correctly, okay, so we should know what technique we can use while talking to the patients, the communication techniques. So where we can use which method of communication, which technique we can apply, everything we should know. So when we apply correctly, what will happen, So nurse are the student. So plan and structure and evaluate the interaction on a conscious rather than an intuitive level. And it will help this proper technique of proper process recording helps to consciously apply theory to practice. And also, so this will help a nurse or the student, help the student or the nurse to develop an increased awareness to the of her habitual or verbal and normal well communication pattern. So and the effect of those patterns of others. And also this will help the nurse to learn to identify thoughts and feelings in relationship to self and others. And also it helps to increase observational skills. So while talking to the patient, we will observe the patient. We are listening. We are listening, but what will happen, our thinking and the classifying ability, sorting ability, and our observational skills. So it will improve. And also this process recording. So this corrective. So when we used all techniques in a correct way, this process recording help us to increase the ability to identify problems and gain the skills in solving them. That's the thing. The fifth point. It helps to increase the ability to identify problems and develop skills in solving them. Okay, and also we can use this process recording. So this is a tool. This is a method. So this process recording tool we can use in educative. Use it as educative tool, a teaching tool, a diagnostic tool, a therapeutic tool. Okay, so then we will see discuss about goals and objectives of therapeutic. So this therapeutic communication, that is what process recording. So yeah, so we are establishing a therapeutic nurse-patient relationship. So the main goal and objectives of this process recording is what? To maintain proper therapeutic nurse-patient relationship. That is very very essential thing to give necessary health education to the patient. So while making conversation, while talking to the patient, so wherever necessity that we need to identify, so those places, those people, we need to give proper health education to the patient. So we need to obtain. So to obtain the identification data of the patient. So especially for what? To obtain and the identification of the data of the patients. So after collecting data, it is easy for us to identify the patient problems. Based on that, we can plan next what to do. So next what we can do to assess the insight of the patient. So especially psychotic patients, they will people they will not have insight about their problem. But so in the neurotic patients, with psychotic symptoms, people may have insight about their problems. When the psychotic people, they will not have insight. So to assess insight level of the patient, we can ask those sort of questions. We can have so we can get information about their insight through this what process recording. So then the next thing is guidelines. So these are the general guidelines. Process recording is one method by which we can record the content of an interview. Okay, this is a method by which we can record the content. So while making conversation, So whatever may be, sometimes nodding your head or when the smiling and the silence, oh, everything we can record. So with the patient permission. So before recording itself, we need to get patient permission. So then we can record all those things, whatever we are having communication with the patient, and record the conversation verbal time, and use a recording device and obtain patient permission. So for using it, this will and reviewing the session if needed. So which means recording with some devices, the mobile phone or the tape recorder. So we need to get, as I said before, we need to obtain patient permission. That is consent. Without patient permission, we cannot record anything. We need to get consent for that. So each process recording should be concluded with a summary. So we will start by saying hi, hello, and we will have good communication. We will gather all the information. We will gather all the information about the patient. So we cannot, after getting all information from patients, we cannot come just like that. Okay, so we need to conclude it. We need to give a brief summary to the patient, and the termination should be pakka. So each process recording should be concluded with a summary. So once we terminating the place, and so we need to inform the patient and come, and while recording the summary, while documenting the recording, so there should be a full data we should be summarized. So like so within one paragraph we are giving about the patient whole thing. Okay, the what techniques we used, and what are the problems we identified. So how much time we took to complete this, everything there should be in our written summary too. Okay, so then the recording process should be end with a brief summary to evaluate whether initial objectives for the interaction were met. And why? Because the before starting the conversation itself, we will frame objectives. So while making conversation, so these are the things we need to met. So for this, we need to give health education. Okay, so some sort of goal we set before starting the process recording itself. So this will summary will help us to find out whether our objectives, initial objectives for the interaction were met or not. And if the objectives were not met, provide a brief analysis of the reasons thereof. So this provide an opportunity to modify the conversations. So evaluation is very, very essential. So why we couldn't meet the objectives what we planned before? What is the reason behind that? The analysis should be there so that we can modify our conversation for further episodes, and we can so met our initial objectives what we planned before. Okay, so then, so these are the prerequisites for process recording. So that first we need to get consent from the patient for the possibility of cassette recording, as I said you before. So this is very important that we need to get consent from the patient for cassette recording or whatever it may be. So that some other kind of source of thing we are doing, so recording we are doing, also we need to get consent from the patient, and we need to maintain confidentiality. We should confidentiality should be maintained by us. So we cannot share any of the patient information to others without their knowledge. So confidential, some areas we need to maintain confidentiality. That is trustworthy relationship we need to maintain. And physical setting, calm and quiet environment should be there. So sometimes conversation based on the environment. So on crowded places, so noisy places, disturbed situations will not make us to talk and clear. This is the quiet environment, the calm environment will make the patient to talk. They will talk, and their mind should be in a pleasant situation. Okay, so physical setting also one of the main thing here. So that also we need to focus and outline for process recording. So these are the outlines, which means otherwise known as outline lessons. These are the basic steps. So introductory material. So in the introductory material, how it should be the process recording. It should include a short description of the patient and patient name, age, education level, health problems, and the length of stay in the hospital, and also date, time, place, and what else? Those things, interaction, and all those things. So setting, everything should be there in the, yeah, so introductory the material. And so immediately prior to the interaction, it will be helpful in understanding the thoughts and feelings of the patient. So and also this process recording, it is also helpful to record the thoughts and feelings of the nurse just before the interaction. And the reason for choosing the patient and the duration of the nurse patient relation should be also we need to include it. And to understand the patient in a better way, what we have to do is process recording. We need to include personal history, patient family history, and social economic history, and medical history, present complaints, past psychiatric history, also, and in the introductory material. So the objectives, the second process. So yeah, this objective should be formulated prior to the meeting. So what we are going to do for the patient. So our what is our goal? That is that objectives we need to frame. We need to formulate it prior to the meeting, prior to the process recording. So it should be specific and readily measurable. So we cannot say this, that, and the way it should not be like paragraph. So it should be specific and readily measurable. So and changes in the patient behavior pattern. So and the function as a guide for an interaction. So they can be different on different days of the interview, like so the example, in the beginning setting short term goals may be more appropriate, but then the second stage, that is working phase, the objectives can be more long term in nature. So focusing on corrective psychodynamics, including rehabilitation, follow up, and preparing the family for future plans. So the next thing is context of the interaction. So context of the interaction, which means where the interaction took place. So this context of the interaction describes what? So where the interaction took place, and activities involving the patient that occurred before the interaction, and the patient physical appearance, and how the interaction began. Okay, so this all those things comes where context of the interaction. And the next one is a record of interaction between nurse and the patient. So this should include truthful. So recording the interaction, so that should be the truthful. So whatever nurse says, nurse actions, behaviors, and the patient behaviors, patient actions, and changing the positions, looking at various things, eye contact, biting at the nails, whatever it may be, and the tone of the voice and the rate of the speech and everything should be in a pakka manner. So we cannot manipulate here. We cannot change anything here. Okay. So and why? Because we are asking nurses part also should be there in the recording. So this will help the nurses to do self evaluation. Why, the nurses' thoughts and the feelings also should be recorded. The reason is self evaluation can be made as to how these influence her behavior. Okay, so sometimes we will be maintaining silent during conversation, during collecting data, in process recording. We will maintain silence, right? That also important to record. So these are the techniques: silence, nodding, head, and broad opening. So eye to eye contact. Everything comes under where communication techniques. These communication techniques where we are using while maintaining process recording. We will use all these techniques while recording this. We should not cut any part of it, and we should not remove anything from the record. Everything should be in a right manner. That is, truthful recording should be there. So then analysis of the interaction. So analysis of the interaction should be include the interpretation of the verbal and non-verbal behavior. So verbal and non-verbal behavior, and the patient thoughts and the feelings, and everything should be analyzed by the nurse. And here the recording in the process recording can be written as short notes. So from the short notes we can get so we cannot stand and write detailedly about the patient. So we should have the capacity to take short notes in front of the patients during the interaction. And after the interaction, so after the termination from the conversation, so what we have to do is, so from the short note we can rewrite in detail. So this is not in front of the patient, so we can go to our place and we can rewrite immediately after it. Why immediately after it? So or else what will, so otherwise we will forget whatever we a patient has been given. So for whatever the information has been given by the patients, we may forget later. So immediately we need to go and sit and write, we need to rewrite. So how? So by from the use of on the short notes, we need to write detailing about the patient. So and we need to spend for the recordings, this process recording can be around 30 minutes we can take. So this is 20 minutes. For active time. Okay, and active time in the sense we will talk, we will collect. Okay, so next 10 minutes, 20 minutes. 20 minutes is what active pace, and the 10 minutes for conclusion and recording. 10 minutes is for conclusion and recording. So totally, we can spend 30 minutes for uh, process recording. Each process recording we can spend 30 minutes time. And so these are the process what we discussed now, right? So that is preparation phase, the before the conversation, how it should be, the how the preparation should be, and record as patient interaction. So the second phase, so while maintaining interaction, we need to record as patient interaction, and written process recording may be begin with taking during the interview. So short notes we can take, and identification of data, which means identification of the problems from the collected data and present complaint. Finding out the problem and the present complaint. Based on the complaint, we can plan something for the patient nursing intervention, and we can implement. So for further and the further improvement, or so how to change our talk or conversation for further session. Everything based on the collected data, we can decide. So this process recording, so as I said you before, so this process recording should end with a brief summary. So to evaluate whether initial objectives of the interaction were met, as I said you before. So here, conducting process recording gives us the opportunity to improve as as the patient, the student, opportunity to improve the communication skill and self-awareness skill and assessment skill. And we are learning to listen, observation skill will develop, and role playing skill will develop. And a process recording provides with the additional opportunity to practice nursing values and ethics. So to process recording is a very essential thing in psychiatry, as well as the growth and professional development of the students and the nurses. Thank you.